Hey, y'all.
Well, I would give it 1 second just to get on there.
Well,
Do we start with like a secret handshake?
Don't show them our secret handshake.
They can't know. Anyone that's already on here. I love it.
Just waiting for
I know.
you.
I started to say something and then she cut me off. How rude.
I know. So nobody's on yet. I can't find us yet. Hold on. Let me find us.
Come on,
and then
Emily.
we'll...
Where are you when we need you?
Did she watch us last time? Tina watched us last time.
Yeah, Emily watched us last time. Holly was here.
Holly was here. we had people here and she was.
I feel like there was someone else that watched us though.
We could. I wish if we did it.
We need people who don't
Is it
know
not
us to
showing?
watch us.
Are you under yours still, or are you under?
No, I'm on Elite. I'm not that dumb. I have done that before, though.
I didn't mean it to be dumb. Like,
But
it's
this
something
time
I
we
would
are
do. I
elite.
wouldn't look at which profile I was under. That's just how I roll.
Am I supposed to be looking at something?
I mean, I got us.
Yep, we're there.
Hi,
We are there.
Hi,
So
Pauline.
It's delayed though. I just pulled out my phone, so it's in a little bit of a delay. You'll get there in a second.
Oh, there. Right there.
I think
So-
that's in case anybody gets murdered. To be honest with you,
There's one person watching. Me.
it's me.
Oh, I thought it was me. Now there's two.
Me and you. All right, let's just go.
Yes. 'cause
Hit
we'll-
it.
We'll put it up. Hello, y'all. What?
I said, we're waiting for
Oh,
you.
we
Tune
are-
in.
Okay, time out, start over. Hello, everyone. We are back. Mary Beth and Pauline. That's what I mean by we.
Yeah, we.
Last
Small,
time,
intimate setting tonight.
yes. Last time we had a little group, but today it's just the two of us because we are going to talk about direct access care, also known as
Direct
cash-based,
patient care,
direct patient care,
cash-based.
cash-based, out of network.
What does that mean?
Well, funny you should ask. Seeing as how we were talking about how we needed to explain. So let's do kind of the first thing, I guess, is yes, explaining that. So when it comes to how Elite Rehab is set up
And Wellness for Women.
Wellness for Women, we are set up as you do not have to have. Well, I don't think you need a referral, right?
You as the patient have the choice.
You can go wherever you want. You do not need a referral from anyone to come to see us, and you are not bound by any insurance restrictions, meaning specifically talking about physical therapy.
Yeah, what does that mean for PT?
Yeah, because it will be different for you. So for physical therapy, it means in the state of North Carolina, we have direct access as physical therapists. So that means you do not have to have a referral from a physician to go to physical therapy. Now
I
that
can
has
just
changed.
decide I cranked on my knee and I need help, and I can
Yes.
call you and set something up.
Yes.
Please.
So that is one of those things that has changed because it didn't used to be that way. You used to have a referral, but now you don't. You can go to a physical therapist if you tweak your back, hurt your knee, whatever. You can walk in and you can be seen. There are some caveats around that, but I'm not going to dig into that right now. So that's what direct access for physical therapy means.
Okay.
Then, because I'm cash-based, which means out of network, I don't have a relationship with any insurance provider, medical insurance provider. So that means that they can't tell me how many visits you get. They can't tell me what treatments you're allowed to get that they will cover or not cover. They don't dictate really anything like you need to have x-rays first, and then you need to do this first, and then you need to do this. So you can come see me, you get right in.
No check boxes.
No check boxes.
Oh, darn.
No hidden fees that are going to pop up later when your copay is this and your co-insurance is this and your deductible is this. You just know what you're going to pay.
So are
and
you
you're
an hourly fee then?
Yes.
You pay for time.
Yeah, you pay for my time.
Okay.
So that's kind of the basics of it. There are some nuances with it,
Sure.
particularly depending on some other types of insurance, which I can speak on later because I want to kind of stay in the same vein. So for you, what does it mean to have direct access to women's health?
Similar, except for it really hasn't changed in regards to women's health, or I'm more of a primary care access. So really, you want to see a primary care doctor, you want to see an OBGYN, you always have the choice wherever you want to call. You call, you set up an appointment. Same with me, except don't call me, just go to wellnessforwomenpllc.com and self-schedule because you get to see the whole open calendar. But you can schedule with whatever. The direct patient care model that I follow, though, is that the fee that you pay me is just for my time and my services. So I charge an hourly fee You can show up and talk to me about whatever you want. You can talk to me about Aunt Sally. You can talk to me about your period cramps. You can talk to me about your menopause issues. Doesn't really matter because, much like you, in my model of care, I am not bound by what insurance says I can and can't do. I'm not bound by a 15-minute time spot. If we get to the end of, you schedule for an hour and we get to the end of that hour and we haven't covered everything, then we either continue if I have opening, or you schedule another time to come back in. There's no start and stop dictated by anyone else other than what your needs are. Having said that, so my time is cash pay. But if you were to need x-rays or imaging, or in terms of an annual exam, a mammogram, pap smear, labs and imaging can all be billed through your commercial insurance.
So you just write it, send it.
I write it,
done.
send it. If you're getting labs, you give your information to LabCorp. If you're getting imaging, it's wherever you're getting your imaging done, whether it's Carteret or Coastal Imaging. When you go to those appointments, you give them your insurance information, and those services are billed through your insurance.
And I can vouch for how easy it is. This is really easy.
Yeah.
So I'm glad you brought up about the, you can talk about anything you want.
Mm-hmm.
That's actually something I didn't mention, but with physical therapy, a lot of times we'll go in and it's your knee is hurt. But other things kind of happen too. So if your knee's been bugging you for a while, your ankle might start to be hurting a little bit. Your hip maybe doesn't feel great, back doesn't feel great. Traditional physical therapy clinics are going to say, we got to focus on your knee. And some of that is because it's insurance based. They want to see that you had this box checked and this is what you came in for, this is your diagnosis, and we're going to treat it. And some of it is time constraints because there's so many people being seen at one time that they can't really treat every single area. So I can do the same. So, and it happens, like you'll come in for your knee, but that gets better in a visit or two, and then it's like, but now my hip is kind of bugging me. We can work with all that. I can move in and out. I can have one day, different body part another day. Like it's really up to you what you want.
But I think
to
that
work on.
segues nicely into another topic I wanted to hit, which was, what's the benefit of this direct access? I mean, the obvious benefit is you get to choose. I mean, so if you want to see me or you want to see Pauline, you call us up and you come see us. No one's telling you you can't. But what I view, and you may have a different opinion, what I view as one of the biggest benefits is just that. Mm-hmm. You go and see Pauline for a knee. She has an appreciation that knee does not function in a vacuum. So if you've had a knee injury for even just a couple weeks,
right.
It has impacted how you walk. So you've probably impacted your knee, your ankle, your back. She doesn't have to go, oh, we'll need a different referral for that, or oh, we'll need a different. She has the appreciation that all those things work together. So over the course of your treatment plan,
I can
work
hit
that.
it all. Yeah, I can hit
And
it all.
similarly for me, I mean, I frequently see people for weight-related issues. Well, let me tell you, that's a whole deep dive into the rabbit hole, because not just one thing can cause your weight issues or your lack of ability to lose said weight. So if we need to investigate gut health or menopause or anxiety, all of those, I am not restricted, and I can appreciate that there's multiple factors that play into one issue, whatever that issue may be. I think that's kind of cool about the direct access.
Definitely one of my top reasons for it. I think one of my other reasons why I really love the ability to do what we do without having some of those restrictions.
Because we can
actually,
laugh.
we do. There's multiple actually. One of the big ones is I'm not bound by insurance. Dictates a lot in physical therapy. So when I say dictates, meaning a lot of people like driving lane.
Handcuffs you.
And that is not considered by most insurances something that's covered. It's still, despite the fact that it's been around for a long time, and it has been proven to work in not
There's
all,
science.
but in some cases, it is still experimental. So it doesn't often. So some insurances will cover it.
Right.
Well, so then you either have to decide as that clinician in that clinic, am I going to do it anyway and write it off? Am I going to charge the patient for it later? And they're going to get a bill because
And go,
insurance
wait,
did
my
it.
appointment was covered. Right.
Or are they going to just an upfront charge you? So then you're still paying your copay, but then whatever. So different clinics do it different ways. I don't have to worry about that. I can do what I want and what I think is going to work without having to worry about, well, is this going to be covered and how much is going to get reimbursed? that also lightens the load for me in the sense that I can then pass on some of those savings, because it sounds a lot of times people think it's going to be so much more expensive because they're paying, because they hear that hourly rate and they go, oh my gosh, okay. Or I sell packages, and they'll see the package price and go, oh my gosh, that's a lot of money up front. But you're not. There will be no surprises later.
But if you could break it down
Yeah.
and do it a non-direct access way, yeah, it's all those little tiny
They kinda-
charges
yeah.
that start adding up.
They
over
start adding
time.
up. So I have had clients in the past, when I was in a traditional clinic, that they'd pay their co-insurance or copay, because those are two totally different things. So don't get me started on
We
all
don't
that.
have time to discuss that.
No, but let's say as in physical therapy is a specialist. So like when you look on the back of your card, you have different rates, different copays for different types of visits. So physical therapy is usually a specialist. So that can be anywhere from, some insurances are $50 and some are up to $100.
I'm not
So
special.
you're not.
I'm not a special.
Oh, well, we get to be specialists. So so you got to look at that. So then, okay, now you're looking at, well, how many times a week do they want to see you? 2, 3. Standard is 2 to 3 times a week. So then
At
you're
least
looking
initially.
at that, at least initially. So then you're looking at that copay. So there you're already like $100 in if it's only $50. But then they're gonna want to see you for how many weeks? So you kind of factor all that in, and sometimes that actually end up being less expensive depending on the insurance that you have than you're actually thinking you're going to get. And then, like I keep reiterating, because it really is a big thing. Like, you don't think you're going to get a bill later, and sometimes 6 months to a year later, you forgot, and you get this $1,000 bill because it's all the stuff that it took that long for insurance to kick back and say, well, we're not going to pay for it. And so the
I
clinic
think
has.
it's worth figuring out the math problem.
I think it is. Now, I'm not going to say that I'm always less expensive. Sometimes I am more expensive,
Right.
but quality matters.
Well, that's what I was going to say. So number 2 on my list of why I like this model of care and have participated in it myself as a patient, not a provider. Number 2 is, if it's a weird problem,
Yes.
you don't know what box you fit in.
Yeah.
You need someone that has that, for lack of a better term, flexibility to pivot when it's not a very straightforward cookbook, cookie cutter problem to solve.
Well, and you need the attention. You need the care.
Right.
Like, you need my attention to be on you and vice versa. I want your attention on me. I don't want you worried about the next person that's coming in 15 minutes. Or I don't want to be, as a physical therapist, working with 3 or 4 other clients at the same time that I'm trying to go, well, you do this and you do this. I want to be able to go, nope, you have my full attention for 1 hour or however long, and you get everything that I have for that. So then, no, I don't see as many people in a day, so my brain's a little bit fresher. I have a lot more energy to give to my clients, and that's something that I really enjoy from the practitioner side, not just the patient side, of being able to have that attention on me, but mine's like to be able to give it. I want to give the best of myself.
Well, I mean, if you break that down, so say the patient, and it works for both PT and for just OBGYN or GYN issues, if, total time to address this person's issue is going to be an hour, and in a traditional setup, you had 4 15-minute blocks, well, crap, you're spending a good 5 minutes to get your brain back on what went in your last visit, whereas if you have an hour-long setting, you start to finish. You ask the questions you need, you follow the trail wherever it may lead, and it's just a much,
So I did look it up, and does anybody want to guess the average time with a provider in an appointment?
I think it's less than 10 minutes.
It's 7 to 12 minutes.
Yeah.
I would,
So-
I would say
What's our average time? Because I can't shut up.
that's true.
60
You'll
to
get-
70 minutes in an hour-long setting.
And I am pretty good about. I am on the money, and I will go over too.
Yeah, that's crazy.
It is nice.
Yeah. So, I mean, you get what you pay for.
You do, and now for
But that's
me,
why I was saying, so that's why I feel like it's worth doing the math problem. For
Yes.
instance, personal level, screwed up my collarbone. I opted to do a traditional referral-based route for physical therapy. I did my 4 to 6 week course before they patted me on my back and said, yay. And they did a great job. I don't have any complaints. But at the end of what they said was my 6-week stint, or rather what insurance said was my 6-week stint, Nemo over here still didn't work like my real shoulder.
like she wanted to do.
So I had run out of my options at the regular approach PT. So I dial up my friend Pauline and I say, Nemo needs to work better. And so
And we work on it.
for me, that math problem worked. I was able to utilize my insurance for that front side. And then when it got to be, excuse me, a harder problem where you have to dig a little deeper and you have to be a little bit more creative, that's when you earn your specialist tag.
Yes.
Yes.
And that's a really good point too, because I often do tell clients, like there are circumstances where I say, use your insurance. I don't really want to see you because to me, at that point, it's sort of you could be spending your money better ways.
Oh, we are frugal if nothing else.
Yes. Then, so for instance, to be more clear, if you were going to have a surgery, like a total knee replacement, total hip replacement, rotator cuff repair, back surgery, just any type of surgical procedure, I'm
Sure.
going to look at you and say, use your insurance initially. That is very basic care. It's kind of, I don't like the word cookie cutter for that because I won't say that everybody
more
does
standard,
cookie
though.
cutter, but there are protocols to follow.
Yeah.
There are certain expectations, there are certain exercises that we all know you're going to get. I don't want to give them to you. One, it doesn't, I'll be honest, it doesn't challenge me enough as a clinician. I've been doing this for
That's
20
fair.
years. I want to get you from that where PT got you, which is usually functional
Right.
or okay. And when I say functional, I mean back to your day to day. That doesn't always mean that you're back to your sport. It does not always mean that you're back to where you wanted to be.
Right.
It means you can take care of daily ADLs. I want to take you from there and get you the rest of the way to where you want to be, if not even better than you thought you could be.
Right.
So I will often have conversations with clients where I'll say, you don't need to come to me right now. Use your insurance benefits, save your money. Come see me after. And then that works out really well. So I also like having that respect for people's time, energy, money, in that way.
And
I
I've seen
can
you
say
do that on a number of occasions.
And if I'm not right for you, like
Right.
I will not
Right.
see you. And I know you're the same. We will get you where you need to go.
So we've got some people watching and some people commenting.
Oh,
and
excellent. Hey.
I know, say hi. Emily has commented something that I think is great. The problem with insurance is PT are forced to treat the injury and not the individual.
Very true.
Well said.
Absolutely. I know. There
Yeah,
we go.
that is
Thank you,
very
Emily.
Symptom management, not treatment.
Right.
Yeah.
Yeah.
Not root cause treatment.
Yeah.
That
I mean,
was
and
really good.
that traverses into the medical realm too. I mean,
Absolutely.
and where the traditional model is, fix the symptom or the illness or the disease process that's in front of you, but doesn't allow for time, energy, or creativity to figure out what the root cause of that problem is.
Well,
I mean, it's
not.
great. It's a great model of care 'cause you keep fixing symptoms, but if the problem's never gone, there's always going to be symptoms. But in a direct patient access where you're paying for time and not services, you're paying for time and education and
Yeah.
creativity, you're going to get to the bottom of that problem. You're probably going to get a more longer lasting result.
Agreed. And there's a lot to unpack in that. But there's a
Oh,
lot
there
that goes
is,
on
there
in
is,
the
yeah.
background of the medical field that people I don't think always know. And it's, there are certain rules and regulations and standards of care. And so there are some things where you get stuck sometimes. And you kind of have to follow some ways.
I think there's a public expectation that all medical, and I'm speaking medical care, all medical care is created equal. And then if you
Yeah,
go
it's
to a
not.
doctor, they should be able to fix your problem. And it took me a while to figure out, and it may make me sound jaded or cynical, but all medical care is not created equal. And the model of traditional medicine, which is typically insurance-based, is not set up to provide the kind of care that a lot of people need. Yeah.
It just can't. It's too.
I mean, it's a bummer, but it is, and so
It's got good. Insurance
It's
is
good for-
obviously
it's good
not
for
my
the basics,
favorite.
right.
Yeah,
It's
it's
good
not
for the
my
basics,
favorite, but there is a place for it. I mean, I think
No,
it definitely
absolutely.
there's good parts to it, but then yes, I think the way things have evolved over time that nothing can be managed when you're dictated so strictly what you can do. I just think you're gonna treat the symptom, not the cause.
Right.
And I'm gonna treat the cause. So that's kind of those are some of my favorite parts, I guess, when we were talking
Yeah,
about
me too.
the bonuses of it. I mean, I think we could probably come up with a bunch more, obviously, a little biased, but I mean, I just think that there's just a whole different level of I don't know, thoughtfulness that goes into it, and just that I know to speak for you, because, you know, I might be a client of hers. Hey, I can say it.
No names, please.
No names, my name. But I can say from working with you, it's just, you will dig into stuff, and then it's, I don't know, it's just this, you think about it later, and then something will pop up, and it's like you don't just forget about me later, and I try to do the same with my
I will finish a
clients.
visit and have the thought in my head, wow, that was a very random conversation.
Mm-hmm.
But then later, it's just the way my brain works. It will piece together those random bits of information, and a lot of times I can come up with an aha moment that way.
And you will
And I
reach
couldn't
out.
do that in 15 minutes.
No. And you'll reach out and like follow up on that, which I will say is unusual and
It is.
pretty
It
standard
is.
care. Like even if a doctor had some thought later on, they're not going to necessarily have the time to reach out and say, "Hey, did you think about this?" Whereas you can, because we're able to
I was
keep
gonna
our
say, so
client base smaller.
Now we're dialing into the nitty gritty
Yes.
of why Pauline Shiver is good at what she does and why I
Mary Beth
provide a
Williams
different
is
aspect
good at
of
what she
care.
does.
Thank you.
Great at what
But
she
anyway.
But
it's,
yeah,
it's
I
a
mean,
unique experience with us. I
It
think.
is, and I think it allows us to keep a smaller caseload, so we don't feel so, or at least I don't feel so overwhelmed all the time, and I can deliver some of that like unexpected. Oh, did you think about this? Or, you know, that was like you said. Sometimes you have those aha moments, and you're like, maybe it's not orthopedic, maybe, and then I can get to the right place, and I think that's just an aspect that you just don't get everywhere, or I haven't in the past.
No, and I mean to link it, bring it back. I mean that is an aspect of that direct patient care because we dictate our 30-minute or our hour-long appointments, whereas if we were in a traditional model of insurance-based, we couldn't do that. So there, I just locked that together.
I love that. What do you think about preventative care versus insurance, like just treating the problem? Like, I feel like I see you guys doing a lot of wellness, preventative care.
Yes. What is the saying? An ounce of prevention is worth a pound of cure.
I have heard that.
Yeah. It's true. I mean, I think insurance could be better utilized if it paid for prevention versus the cure.
It does
But
not.
I will say yes. I think that's another avenue. I think that we're able to go down because we can spend a little more time. We can do a little more education, and we don't have to focus specifically on, and I don't know all the details of the medical side of insurance, and kind of, because I know it's a little different how we bill and code and things like that, but we very much have to look at certain insurances are going to look at this, and they're going to look at that, and they're not going to cover this, and they are going to cover that, and prevention is never covered. So, like, you're not going to spend your time on it, and you're not going to educate on it, whereas I don't.
'Cause
I
you're
want
not getting
to.
paid for it,
Yeah,
right.
you're not going to get paid for it.
It is an interesting question and not a very straightforward answer on the medical side of things, because typically with commercial insurance, annual exams in the women's health world or preventative, well child checkups, that typically most commercial insurance policies cover those visits entirely. So for an annual exam once a year, you get the exam covered, the mammogram covered, the pap smear covered. Pap on an every 2 or 3 year basis. I won't go down that rabbit hole, but nevertheless, you get what I'm saying. Insurance covers it. No copay.
Okay.
No
okay,
co-insurance.
yeah.
It's 100% covered as a preventative exam. Now, as healthcare has evolved, though, when I started in practice many moons ago, 20, 25 years ago, an annual exam when I would see people in my office was pap smear, breast exam. How are you? Do you have any other issues? How's your sleep? How's your weight? How's your family? It was an all-encompassing visit. Oh, you want to talk about birth control and what options there are? Oh, we need to talk about PMS. Yeah, probably. But all of that was included in that preventative care visit.
But it's not like that anymore.
But it has evolved to the point, because the visit times have shrunk, that when you come in for an annual exam at most places, and I won't say all, never say never.
Yeah, you can't make a
But in
blanket
general,
statement.
when you go into an office for an annual exam, you are getting pap and breast exam. You might get your lungs listened to and your heart listened to. But if you do ask anything else outside of pap and breast exam, then that's when those hidden charges start coming on. So I tell you that background because if all you need is a pap smear and a breast exam, you feel fine. Otherwise, you don't have anything else to discuss. Throw some routine labs in there. Use your insurance and go the commercial route. If you have an issue that you want to discuss, or you have an interest in educating on a preventative basis, what can I do now at age 20 to feel better when I'm 30 or 40? I think this route of care is a better way to go because it doesn't take an hour to do a pap smear and breast exam. So the remaining 58 minutes, we are talking about whatever is impacting your health moving forward. And that obviously is going to be different for age and stage. If you're in your 20s, your 30s, your 50s.
It's going to change.
But that, to me, in my practice with direct patient care, my annual exam is that all-encompassing. If that means we're talking about your high blood pressure, your anxiety, it's all together. Now, that is not what you can do in a traditional cash or insurance-based. So it's a loaded question.
It is.
There's a lot
And it
of
also
nuance
brings me
it.
to, somebody did send in a question and ask what the ideal age group is for direct care, cash-based.
I would say for physical therapy, I would argue any.
Yeah.
Actually, now, my brain's jumping around a little. The younger the better in some respects in my field.
Athletes.
So, athletes, orthopedics.
Yeah.
So I specifically work with outpatient orthopedic kind of things. There's many other offshoots of physical therapy, but I would say anytime you've got a child that's going into athletics, we are great because we can do
Form, technique.
I can teach all of the things that they're not going to get when you go into a sport. I don't know how many children are not taught how to properly jump. They're not taught how to run.
That's the PT version of preventative
Yes.
medicine. Is
Yes.
teach them the right way.
Prevent how to, because injuries are going to happen. I mean,
Yeah.
we're going to get hurt no matter what. Like our body, it's just going to happen. But you can reduce your risk of injury if you're stronger, more resilient, if you're more flexible, all those
Balance.
things. Yes, and your movement patterns are better. But the older we get, without having some of those things addressed, they get ingrained. And then it's harder to break them and we fall back into old patterns. So anyway, I would argue that for me, there
If you
is a
had to-
limit, but if I had to, I would say probably, 8 years old. I
From a
would say.
preventative
From a
standpoint.
preventative standpoint, yeah.
But
there's
what's the
nuance.
majority of what's your kind of average age group that you see, or what's the highest population age?
Oh my gosh.
Do you know what I'm saying?
Like oh my gosh, I will see anyone from 8 to 90 something.
But the majority of your
But
folks
the
that you have
majority-
in here.
Typically, we're in 30s, 40s. I would say 40s.
Because a little of that, would you say, the youthful resilience has worn off, and
It-
you start to feel the 30s and 40s a
Yes,
little bit more?
and I think some of it too is that I think there's a little bit more we are starting to care a little bit more about how we're going to feel when we're in our 50s and 60s and 70s,
Yeah.
and we start to go, I would really like to feel better, than I do now in 5 years versus
So
if
for
I don't.
different reasons, really all age groups, to answer your question, but for very different reasons, all age groups.
Yeah.
I have the same answer to that question because there are very different things that I think that younger girls would benefit from a conversation about several different things with me. Stress management, because if you learn
Yes.
stress management
Yes.
earlier, it's not going to be as much of an issue or have as much of an impact on your health down the road. The majority of folks I see are probably in their 40s, 50s, because that's when the hormones are raging, and they classically identify the hormones as the issue, and then they tie that with GYN. But had I caught those people earlier, I probably would not see as much of them in their 40s and 50s. Yeah, that's another tough question, not a very straightforward answer.
I know.
I
feel like
love
we're- I
these.
know. I feel like we're giving.
Yeah.
There's so much
But
nuance
you're
to
getting,
it.
you're getting the pluses and minuses. Again, I still go back to if you feel like you have no issues and all you need to do is make sure that your breast exam, your mammogram, and your pap smear are fine, we're probably not the people for you.
Potentially, but then I would argue that I'm pretty check the box, or was standard recently, having some changes where I feel like, I don't have a whole lot going on, but I like the fact that I can look at you and ask all these questions, and I don't have and we're going to troubleshoot and look at you and go, okay, this is where I am now, but 10 years from now, where am I going to be? How can I make that the best 10 years?
But that's a different level of interest too. Which,
Yeah, that's true.
brings me to why, one of the reasons I ever started this model of care, which is I wanted to take care of people who wanted to take care of themselves.
Yes, I love that.
Which is
Same.
probably more an easier answer to your targeted audience. So at whatever age, people who are interested and realize that they need to be a part of the health solution, whether that be medical or physical,
That's a good way to
physical
put it.
therapy wise, that is the sweet spot for a direct patient care access.
Yeah, I mean, cash-based medicine is an investment in yourself. So
It's
Absolutely.
investment operative word there.
Absolutely.
there you go.
It's not cost, it's an investment because this really is. What's that? What's the quote? It's something about if you're not going to make time for your health now, you're going to have to later because you're going to be sick or something like that.
If you don't
know what I'm
make
talking about?
time for your
You know what I'm talking about.
yes,
I
Oh,
can't
it's a
think
good
of that,
one,
but
too.
it is a good one because you
Yeah.
are. If you don't put that
You'll
effort
pay for
in
it
now,
at some point.
At some point, you're going to, or people will say, "Oh, I don't want to pay for it. I don't want to pay for it." Well, you will be paying for it later when you have hospital visits and all kinds of medication that you
If you
could have
don't-
avoided.
If you don't,
Right?
if you don't put your effort,
know.
We're going to put that up later. We're going
Yeah.
to Google
we'll
that.
tag
and put
that.
it-
We'll put a pin in that one.
Put a pin in that
But
one.
it's such a true
But
quote.
it is a very true
And so
statement.
I think that's a beautiful way to say it is if how invested are you in your health? The more invested you are, the more you want to live a long life, healthy life, enjoy your life, be able, like, I always come back to independence for physical therapy because when we get into some of my older clients that are in their 70s, 80s, and particularly if they are independently, like, living
These are
alone,
my favorite ones to watch.
so
in
much
here.
fun. But if you want to stay independent, live alone, like you really do need to think about how are you taking care of yourself now. And so I would say that age group that comes to see me is very invested in their health, and they want to take care of it for as long as they can. And
Yeah.
and it's a fun group to work with.
Because it's no longer about living longer; it's about living
Living better.
healthier. And yeah, I don't want to be in a wheelchair at 90. I would rather be causing people problems. at
On the golf
90.
Oh
course.
yeah,
Yeah.
yes. If I'm in a wheelchair, you know I'll be running some people over.
I want to be racing. If I have to be in a
Yes,
wheelchair, I would
racing.
like to be racing in a wheelchair.
Yes.
Like not well.
Oh
behaved.
yes, kind of like those little what was it, the race you went to, the boxcar race,
Soapbox.
soapbox
derby?
derby. We could do it in a wheelchair,
Yeah. They've probably been done. Yeah.
and I
would
would be
imagine.
wearing my dinosaur costume.
We're going to take it back to medicine, not how much of a terror you two are going to be in 20 years.
Watch out.
Talk to me about the detective work that both of you do.
The
What?
detective
Us?
work? What are you talking about?
You got a problem. This is.
It's always very straightforward.
I think that's my favorite part.
That's right. I'm gonna lead on this one.
Okay. Go.
It's one of my favorite aspects of this kind of care. I've always liked puzzles. We won't digress on the true crime story, but nevertheless,
Ooh, don't get all of us will get started on
I
it.
like a good puzzle. So if people come in back to the, if you have straightforward issues, I'm probably not your chick. If you've got things that are a little puzzling or the traditional route, traditional medicines have not worked, I might be your chick. Because when I talk about talking with a patient for an hour and having seemingly random conversations, different questions, it's in those questions that I'm actually very targeted about what kind of data I am mining. Because I can take aspects of your lifestyle, your exercise habits, your relaxation habits, and I can translate those into root cause of your problem and more importantly, solutions. But it is kind of like detective work. And I kind of like that aspect of research too. Don't tell anyone that, but
Dude,
I
we're both
do.
nerds.
I mean, I
We
like to
like
look
it.
into what causes. My favorite question growing up, and still is to this day, is why. And I apply that on every patient I see. Does that make sense?
Yeah, I think that totally sets you guys apart from traditional providers.
Yeah, because I agree. I do like a puzzle.
I mean, honestly, traditional providers,
well, they don't have the
you
time.
can be crass and say they don't care, but I don't think that's it at all.
I don't know.
I
Absolutely.
think there's a lot of fine doctors out there, but you don't have time.
I think there's so much, behind that. But I'm the same. Like I like the puzzle piece. I happily treat, what we would say easy standard,
Sure.
a knee, a total knee replacement.
You need some breathers every
But
once in a while.
but I do very much enjoy that. I don't really know why it's doing that, and then how can I trace it up the chain and back? And even sometimes what we think of as these easy diagnoses, like a low back pain, they're probably the hardest because people want it to be some one thing that's causing their back pain or their neck pain, and it never is. So
Back pain is like the weight gain of the medical world.
yeah, so it's, you know. I've never really thought about that, but
But
I
it
like
kinda
that.
is.
I like
Because
it.
there's not one, I mean, you
Because
think it
there's
should be
not,
an
no.
easy solution, but it's not.
It's probably one of the most challenging. And so I wouldn't, there's definitely some things that I love more than others for different reasons, but those aspects of like really trying to dig in and figure it out are fun, and the research is
So
interesting.
I would throw out there as well a benefit of this little setup we have here as far as me having my little spot inside this bigger gym is that our approach is a holistic one. Mind, body, spirit.
My body's
But
all-
that medical things affect physical things and physical things affect medical things. And so back to the sleuthing aspect, we have a lot of conversations.
we're very collaborative.
Yeah.
And it doesn't have to be like you don't have to see both of us. I guess is what I'm trying to say. I may look and go,
we play charades really well.
yes, but I may be like, what about? Do you think about this or do you think this could be
Or if you
something
saw
more
this,
systemic?
what would come to your mind?
Yeah, and so we can do stuff like that, and then there will be times where I have flat out told people like, you need to go see Mary Beth because we need this blood work, we need some of these things to rule out some other stuff, and I think I like that ability to collaborate, and then to have Kim
With the mental health.
with the mental health aspect.
That's the spirit, the whole mind, body, spirit.
Mind, body,
thing,
spirit,
yeah.
yes. That's also great too because there are so many things that come with injury and surgery and
And
you
medical
ha-
issues.
and medical
disease
issues. You have
processes.
to touch on that because you won't get better if you don't address that part. So we do have a very collaborative relationship here where some of that comes into that detective work and the sleuthing because we're gonna figure it out. We're gonna figure it out.
Well, because neither of us really like to
No, I don't like
not
to.
have answers.
Because you won't sleep at night if you don't.
True story.
True story, right? And it is one of the foundational principles of
I
wellness.
know.
Good sleep.
I think I've got like a two-legged stool right now.
And
Maybe
begin.
balancing on one. I don't know.
It's a journey. It's not a sprint.
Exactly. It's a marathon.
Okay, so let's go back to the money of it. If somebody does have insurance,
Yeah.
what can you guys
We're not
do?
locking the door.
Right. What can you guys do to work with them?
So I'm gonna give a very short and sweet.
Not
answer.
locking anybody into anything
Yeah,
here.
but it's a little short and sweet. So I'm not sure yours is quite the same when it comes to insurance. So I can give you a super bill. And a super bill is basically just saying, this is what you paid, this is what I did. It's how standard clinics get reimbursed. We have to put codes in and all this stuff. So I can do that. The issue that will sometimes come up is what type of insurance that you have, because there are some restrictions that I'm under as a physical therapist that not all medical providers fall under. So for instance, Medicare. I don't have any relationship with Medicare. I've chosen not to, so I cannot see Medicare if it is any type of situation that would normally be covered by Medicare for physical therapy. So basically, if Medicare says, well, we think a physical therapist needs to see that, I can't see you. Even if I want to. It's not because I won't see you, it's because Medicare is telling me I cannot. TRICARE follows very similarly with that in certain types of TRICARE. So I kind of will ask a lot of times, just what do you have? Do you have Medicare, TRICARE? Do you have Blue Cross Blue Shield, Aetna, something like that? Normally, then Blue Cross Blue Shield, which is pretty standard around here,
Aetna.
will allow the super bill. What has now started happening though, and again, I don't know if it happens in your
Realm.
side of the medical field, but there's been some pushback from insurance providers for going out of network.
Yeah.
So now they're coming back and having this direct access. So now what's happening is that some insurances, Blue Cross being one of them, but there's so many different plans you have to check, will now say you have to have a referral because we're saying you have to have a referral from a doctor, not because just that plan says.
Oh,
Does that make sense? So it's now.
don't tell me insurance is overstepping.
Yes. So now insurance is saying, okay, well, you need a referral. We're not going to cover it if you don't have it. So you just have to be a little careful. So I would say that a lot of my clients actually end up just paying out of pocket. They don't want to deal with it. They don't want to have to worry about now I have to prove this, and then I have to send this form in, and then I have to do this. So there's a lot of little, I don't know the right word that I'm looking for, but there's a lot of little things that have to be considered.
I think yours is probably more complicated than mine.
I would,
Mine's
from my understanding, yes.
Mine's a tad more straightforward, and I will divide it in Medicare. I don't even give super bills for Medicare because they are an entity in and of themselves and will not reimburse them, and frankly, would come back on me if they tried to get reimbursement from them. So then all other commercial-based insurances, I provide a super bill, which as Pauline said, I mean, medical world, I know what has to be documented. My notes are the same now as they have been for 28 years. Has the proper diagnoses and the proper CPT codes, which is exactly the language that insurance speaks. That's what the super bill has. I hand that over to anyone that asks for it with the understanding that I don't know if it will be covered or not, but it may.
You can try.
This is what insurance looks for. Now, whether they choose to cover it as an out of, because it's always going to be considered out
That's
of
what I
network.
was just about to ask. Yeah.
Whether they choose to cover it or not, I don't know. I have
And-
found it
yeah.
interesting though that my charges for an annual exam are less than what the typical reimbursement is for an annual exam.
Interesting.
Insurance.
Yeah. And mine's the same. When I give a super bill, it's got all the stuff they need, my notes. I still document just as I would if I, was working for a standard clinic.
Yeah.
So I have all that stuff. But yeah, I don't know. Like, it's out of network, so it's based off of your out of network benefits, and then they may or may not decide to cover it. But that's also what happens in a clinic. I mean, I don't know how many times we got charges kicked back and they're like, we're denied, and you have
Right,
to resubmit it and stuff. So it kind of depends on how much work are you going to put in to get reimbursed.
But that's on the patient.
Yeah, but that's more on the client. So if you're going to do it, so
I feel like you have to do that even with regular insurance, the regular,
You do.
traditional
So,
doctor. You have
yeah.
to fight it.
So I think, it sounds like physical therapy's got a little bit more stipulations.
Yeah.
And it's always changing though. So what I say right now could be not true in a month.
Which is why I always say,
yeah.
here's what you
Yeah.
need.
So one thing I do have though is I have, if you are really wanting to submit it to your insurance
Oh, yeah, we
and
have all
see
that
what you
paperwork.
get back, I have all the questions that you should ask. Like, I can hand you all of that, and then you can call and ask.
I will
So
say as a
I've got all
caveat
that
to that though, there are a couple things that I know they won't cover, like hormone pelleting and some hormone
yeah.
labs. I know straight out, and I'm always very honest about that insurance is not going to cover that. Do you have certain things you know absolutely?
The only things that they really don't cover, I think this is again, I have heard that some insurances are covering dry needling, but I haven't been able to find a lot of evidence of that.
Got
So
it.
sometimes they won't.
Got it.
And so I can't confirm. I can neither confirm nor
Nor deny.
deny because I've not done a lot of research into that. But that used to be one that was never covered. Was dry needling, anything wellness or preventative.
Which is
So that's
backwards.
yeah. So that's where Medicare. The beauty too of, I would say, Elite Rehab is that it's not just physical therapy. We also have personal training, and we can offer that aspect of the wellness side. And so Medicare can then come see us for that because Medicare does not cover wellness. So you just want to get stronger, and you're not dealing with again medical issues such as back pain or like neck pain, knee replacement or something, and you have Medicare, you can come if it's just for wellness.
Nice.
But it's out of pocket because they won't cover it. So that's one that I know they won't, and that's standard across any insurance. They don't cover the personal training side of things. So, and
If people are very concerned about that, I always encourage them just to reach out to their insurance before they ever come in.
Yeah.
And see what their insurance's response is to a super bill. And that's a fairly common term. They don't have to know the specifics, but I encourage them to call Blue Cross or Aetna and say, hey, do you reimburse based on super bills? And they'll get an answer, whether they like it or not, but they'll get an answer that way too. Because at the end of the day, you have to be money conscious too. And I appreciate that, and I don't want to add to your stressor list by
same. Same. I'm not trying to put anyone out financially. I always hate saying this because it seems so like cocky to me, but like I know what I'm good at, and I know where I'm going to benefit you the most, and I'm willing to say that.
Well, and
I'll tell you.
I don't think it's cocky because you are just, as you said, you are just as willing to say, no, I'm not the right person for you right now.
And that's
Save your money and
and there are like I totally get it. I totally get it. Mine is always I will always be here though if it didn't work out the way you thought it was, and you do need care later, because then that's the other side of it is, okay, you used all your visits and you have none left. Well, I'm here.
And Nemo still doesn't work. What do you
I'm
do
here.
now?
So you've always got that option. I guess that's the other part I like about it is I'm always going to be there. I'm not gonna have to turn you away because you don't have any more visits left, because insurance only gave you 15 for the year. For the year. And that isn't just per incident. That's for the year. For anything. You get 15 visits, so if you hurt your knee and then you hurt your back, you better don't use all 15. Don't use all 15 because you
Is
don't know.
that true?
Yes. Some
It's not always 15, but yeah,
It's
there's
not
a
always 15,
specified
yeah.
number.
per
Oh,
year.
that's
Now,
terrible.
but that's the other thing. Like, this is why I really hate insurance sometimes. It's not as clear as
Sounds
mud,
like you really feel.
because it'll be like some of them, it's PT, OT, speech combined.
Oh, wow.
So some will say you get 30 visits a year, and then you look into the fine print, and it's PT, OT, speech, and combined. So if you were doing OT for something and
So
then
if you had a
speech,
stroke that affected all of those things,
Yes.
you would be...
you're out.
Ooh.
That you could be done in 2 months and out of it. Now there are some other ways that you can get it covered, but some extenuating circumstances for that. But that's the burden of that is put on your medical providers, and that can be difficult to get it passed through. But no, they will. They'll be like, oh, you get 15 all year. Some will say you get 15 per episode,
Which I would need.
So like you could have 15 for one knee, 15 for the other. But so you really do have to be careful in my field, physical therapy, when you're calling and asking for benefits. You just really need to be clear, because it is something that I did years and years ago, and I remember getting really fed up when I had to call and verify.
It's frustrating.
Because
Absolutely
I would
frustrating.
call one person, they told me something totally different than the next person I got on the phone. So I think and I will say that, my story started with some of that frustration, is watching my clients I couldn't care for them the way I wanted, and then, you're seeing them fight this insurance and it's not covered, and then it's this, and then they're looking at you almost in tears because they have no more visits left, but they're still not where they want to be. And I think that, years of doing that, I was finally like, I'm done, and I know it's going to be hard, and I know it's going to be out of the box thinking, but I'm doing it this way because I need to
What it
care
is, at
for
the end of the day,
people.
that's exactly what it is out of the box thinking.
So.
But
So it's worth it. The
a
hard's
lot
worth
of benefits, yeah.
We have about 10 minutes left. I'm
Okay.
trying to get to the
Okay,
questions
okay.
that were coming in.
Ooh.
So in other words, we need to stop talking.
No,
Right,
you guys
right?
are doing great. You guys are doing great. But people wanted to know if there's like a membership fee. I think that's out there. Do we have to pay something to utilize?
So we started at the top of the hour. No, there is a version of direct patient care, MD VIP. There's different names that it goes by, that you pay a monthly membership fee that grants you access to care.
Mm-hmm.
A lot of those then bill insurance on top of that.
Oh, I didn't know that.
There is that model too. That's why I say there's a lot of our model of care, Elite Rehab, Wellness for Women, is no membership. You pay for your time when you see us.
Pay for
Now
what you
you can
need.
speak of. I don't offer packages, so to speak. You do packages.
I do. I offer packages. It's an option. So if I can sometimes look at you and go, I look at your diagnosis and kind of what we're dealing with, and can. I just got distracted. Sorry, guys.
Squirrel.
Can't believe that happened.
Focus. Bring it back to packages.
So I can sometimes, like, someone will come in and after taking the initial evaluation and history and stuff, I can kind of look at them and go, I think it's going to take you 6 sessions, or I think it's going to take you. And so I've created packages where if you pay in full, there's a discount, a slight discount, but you don't have
I could
to.
come see you and not do a
No,
package. I could
no.
see pay per visit.
Nope.
kind of
Yeah,
thing.
you could pay per visit, because sometimes I will look at people and go, I don't actually know. It might take 2.
Yeah.
So it's just.
Because some things
It's
evolve.
easy.
Yeah.
The other thing that I think I do a little differently too is, yes, I charge by the hour, but I've also had clients come in and I look at them and I'm like, yeah, you just need 30 minutes. So
Yeah, I
I
do
cut
that.
the session, and then you're only paying half that. So it's just so adjustable. So I don't want to create a membership for that because I don't always know what you're going to need. And like we come back to that financial aspect of it, I want you to utilize your finances in the best way possible for you.
When I want them to know what their money's going
Yeah,
to.
what's it going towards?
This
And
is the
don't
fee for
waste
your
it.
labs. This is
Yeah.
the fee for your visit. We spent, I prorate the hours, so we spent 45 minutes. This is your chart. Like, yeah, no.
And I would rather be able to say, I think initially I had some old habits die hard, let's say, from traditional care where it was, I need to see you 2 times a week and you're going to do it for 6 weeks. And so I did have that kind of a little bit of that in the beginning. And I'm like,
Now
no, I
you
don't
have
need that.
Grown
No.
to individualize
Yeah,
your care.
no. So I would rather be able to tell you, I don't really know how long it's going to take. Let's see. And I might see you once a week to start, and then it's once every 2 weeks, and then it's once a month, and then it's once every 6 months. Like, I like having that flexibility.
Yeah, so no membership fees, and it allows it. And the reason for that is
Long-winded
because it
way
allows us
to answer
flexibility. And
Perfect.
individualization. I mean, yeah.
There are some out there that have membership fees. However, you guys
do
do
not.
not.
That's not us.
Correct.
Perfect. What about?
If you want to leave a tip, the jar's on the desk.
I take chocolate for tips. Milk
There you go.
chocolate.
Brilliant. Oh my gosh, you guys throw me off my train
Sorry.
of thought.
Sorry.
That's okay. So, what about wait time? Like when you call, let's just say dermatology. I don't know why that came into my head.
Because
Because it's
it
a
takes
6 month
like 10 years.
Sorry.
It does not take that long to get in.
It does
Yes.
not.
No.
Okay. So
No,
how, like,
typically, I try to get people in within the same week that they call, if I can. Now, if you're calling on a Friday, I'm probably not going to be able to get you in, but I try to within a couple of days of if your schedule.
if you're having
permits.
pain, you can get in.
Yeah, yes, you're not waiting months.
When it's not college drop off, I usually can get people in within a week.
But I would say we're probably much quicker than the standard.
Okay.
I think
Anything
we
to
just
add to
tried
that?
No, I'm surprised.
That's crazy.
Within the week. I mean, I think that's pretty good.
I think that's great. I'm trying to think of the benefits of it. When you say an hour, you get the whole hour, not 7 to 12 minutes.
The whole hour. Because, I mean, well, your case too. I like this makes me chuckle, so don't stop doing it if you decide to come see us. First of all, everyone that walks in here tries to check in at the front desk.
Keep doing it, it's fun.
There is no front desk,
There's
it's
no front
just me. So when you come for your appointment, let's say your appointment starts at noon, I greet you, most of the time, greet you, at noon, we get to work. And you're not leaving me for an hour if that's what it takes. There is no check-in at the front desk, let's get this paperwork in order, let's get this, undress here, leave this sample here, blah, blah, blah.
Go wait in the room.
Go wait in the room while I, laugh and giggle out here. It is, I meet you in the waiting room, I take you into the room, I do let you get undressed by yourself if that's necessary. I give you that time. And then at the end, the payment source is already in the computer, so it's a matter of, is it okay if I charge that card and
Yeah,
you're out the door?
same.
So that wasted time on the front end, the back end, and to your point, that wait time in the room, no, because it's only me, 0 employee complaints so far, only me. Yeah, no, you get the hour.
It's same with us.
Yeah.
Is with physical therapy. I mean, we do have front office.
You do have
we
front
do have a front desk.
I know. I feel
But-
useless now.
Which makes getting your appointment scheduled a little bit easier because you can have a person. The downside to me being only me is that I prefer everyone to schedule online, just
We
because
do have
then
that
you're
capability.
not waiting.
And we do have that capability. You can schedule online for some of our appointments, not all, because ours are a little. We also are seeing personal training and stuff too, so we have to kind of work around certain aspects of things. And we want to make sure that I'm getting the person in for the right thing. So
Yeah.
you can schedule online. We do prefer that you call because I want to make sure that you're not scheduling an appointment that will ultimately be not appropriate for it. Like a Medicare,
I was
scheduling
gonna say,
a physical
you wanna
therapy
make sure it's
about,
appropriate.
yeah.
Me, I
So-
prefer you to schedule online just because you're going to be able to get your appointment in a timely fashion.
But yeah, as for, like you said, with wait times too, I mean, usually we're waiting, we get you back right on time. A lot of times I don't even let my clients sit down. They'll start to sit down, I'm like, come on back. We go right back to the room. It's very much, yeah, you're spending that time with me, and I'm going to give you my utmost attention that whole time. I'm not going to be, you know, like you said, talking to other people or working with someone else, you know, other than a quick hi if I need to, but it's me and you time.
Yeah.
We're going to figure it out.
Okay, now what about the after? What if there's another need? Do you just say, good luck out there? Are you guys an island? Do you have, like...
We pat them on the back and
No,
encourage
do you
them
have
to call if they
relationships
have
with...
concerns or questions. I do. I mean, that's
Yeah.
my. If you're asking, I
You're
think
not an island. Just because you
We're
use
not
this
an
model, you do
right.
coordinate with
No,
others.
so and you touched on that. So easier maybe in the medical world. So I see someone for incontinence. There are a lot of things that I can do, tips, tricks, behavioral modification, things that I can address with them. But if you need surgery, if you need pelvic floor, physical therapy, if you need outside services, I am the conduit to those places. And so I will do referrals. I send, and those, there is no cash-based model for urology, so I am sending you to the more traditional realm. But I will say the benefit is I am sending you to that more traditional realm, very well educated, with probably a laundry list of things to ask, and with expectations for what that visit should be. Does that make sense?
Absolutely it does. So just because you guys use this medical model doesn't mean
No,
No.
I have.
you're alone in
I,
this.
and I think we both tend to, I say vet, but we're gonna recommend people we have a good relationship with that we know are
We're not
going
just
to
sending
help
you
Yeah.
willy-nilly.
I'm not just gonna go, oh, this person has insurance, go here. It's gonna be, what's your issue? This person I know specializes in this issue. I want you here, versus just sending you anywhere. So I do try to have my finger on the pulse of what each place is doing and where, and that way I can get you to the best provider for your need. And yes, it can be, some of them may not take insurance. I do have a couple of other ones that don't always or do like a kind of weird hybrid thing, or used to. They might be doing insurance now. And then I have some other like massage therapists, chiropractors, yoga places. Like all these places that if you're going to ask me, I'm going to give you some.
You touch on that, and I will add that in, not necessarily correlated, but because of this model of care where we're taking care of the whole person and we recognize that there's an overlap of medical issues, physical issues, the knees connected to the hip, connected to that, we, I think, do a really good job of not just sticking with the traditional medical model of care. So we incorporate, we find a use for acupuncture, chiropractor, massage therapy, float sessions.
Yes, yep.
We have an appreciation, and conversely, we will tell you if something's a load of manure.
Yes.
And there's no science to back that.
Yes.
So, yeah, like
Yeah.
I said, not necessarily connected, but equally as important.
Correct.
Because it is an example of a more open mind.
And while it may sometimes feel like we're raining on your parade when we say we don't really believe in something, it's just my ultimate goal is to go, there's probably better ways to address this solution, and I wouldn't waste your time, money, energy there. And I'm also known to be wrong, so if I'm wrong, I will correct that statement too.
I'm
So
probably more of a, if I can prove no harm, no foul, then sure.
try it, yeah.
Yeah.
But if I know something's like
Oh,
legit, this is just not good. No, it's a bunch of
Right.
I'm gonna tell you. I can be put pretty blunt in a very nice way.
Tactfully blunt. Yes.
Because my ultimate goal, and I think yours is too. I mean, I really, when it comes down to it, you walk into the doors of this building, I think you're gonna feel cared for. Just cared for. Seen, heard.
Listen, yeah.
I mean, you're gonna come in and just leave going, wow. I don't know that I've ever had that kind of experience, and you're gonna laugh a lot, but you're not gonna. It's just a different
I
experience
think
when you
we
walk in.
established and created our practice because, I mean, selfishly, I created a practice that I'd want to go to.
Heck yeah, same.
Yeah, I mean,
Yeah,
and I got good taste, so there's that.
true story.
And costumes are optional, right?
but highly recommended.
And not even limited to October. I mean,
Year round.
Okay, let's see if you guys can do this, and we're going to finish it up.
Okay.
Is there a downside to this medical model?
Absolutely
Let's be
not.
honest. No?
I would say yes, there probably are. I mean, I definitely think there can be the financial.
from a patient side,
That's what I'm talking from.
Okay.
Like not from our side. I don't see a lot of downsides from our side.
sleepless nights.
It's the work, but I think that's anywhere. When you care about the people you're helping,
Yeah.
I think from a patient side, I think it could be the cost is sometimes, and
That's when you have to do the math problem.
That's when you have to do the math problem. Like, is it something that could be done through insurance because there's very little involved with it, or do you really need a deep dive into what's going on? It's probably worth it then.
So potentially cost.
Yeah, so potentially cost could be it. I think other than that, and maybe I'm just not seeing it,
I can't.
I don't really think there's other downsides to it. I mean, you're getting so much for your money that you're not going to get at a traditional place.
As a consumer of direct care, woman behind the camera, do you see any downsides to direct patient care? I mean, you've experienced
So,
those models.
well, I will say that insurance has been a struggle for us. We do not have a great insurance plan, so anything we do, insurance is always a headache. It gets denied 12 times. We have to, chase everything. So, no, this is the model for me.
Yeah.
But I'm not everyone. I'm not your typical
No,
consumer.
you're not. I just, and I would like. I mean, I am very tactfully blunt. I mean,
Yeah,
I'm honest.
Yeah,
if nothing
you
else.
very much
I
are.
don't see another downside,
I
and even the cost of it is a potential downside with a little asterisk because sometimes it's not even a downside.
It's not,
if you're
and-
getting the
yeah.
problem solved.
And
Yeah.
and I've utilized it prior to doing it on my own. I've gone direct to care, and I mean, I don't know. I can always say that when I've made the investment, I wasn't disappointed. So I never felt like I was getting ripped off. I never felt like it wasn't worth the cost. So even then, when I was working standard and I wanted care, I never saw it as a downside. But that's the only one I could potentially see is if the cost, you feel like the cost may be a little prohibitive. But it really is the asterisk, like you said. It's going to come down to what.
So if your health and well-being is worth it, then this is a good investment.
I mean,
If it's important to you.
If it's important to you, yes.
If you're not just interested in living and getting by in the day to day, and you want to be proactive in how you live your life, it is absolutely worth it.
And
Absolutely.
I would add, if you're not interested in putting in the work and owning some of the stuff
probably
you
not.
are
you
doing,
might have something there.
you probably we
We're
may
probably
not.
not the
Yeah,
people.
we.
I
may
would
not
say
be
if you
right.
want a prescription, if
If
you're
you-
just
yes.
looking for
If
like
you want a quick
somebody to
fix,
write something, a quick fix,
If you want
this
a
is
quick
probably
fix,
not.
I'm not the person to go to. I'm not
Nor
gonna.
am I.
Yeah, I'm not gonna pat you on the head and make you feel. I'm not gonna give you the easy answer and say, okay, go on. I'm not, and that is so. Yeah, I would say that's the big.
That's a big difference.
Yeah,
I don't
that's
see
the
that
big
as a
difference.
downside.
I don't see it as a downside.
We're not
either,
for you.
But I think you need to know what you're looking for, and if you're looking for that, I just want you to write me a pill or write me a prescription or tell me that XYZ and say go get surgery. I'm probably not the girl for you because surgery's not going to be my first choice for anything. Well, I won't say anything.
But on that note, if you need a second opinion from me,
Heck
and
yeah,
surgery may be on that list,
Yeah.
I mean that's.
But I'm gonna want to try some other stuff and look a little deeper. So I would say I'm not the person you need to come to check a box.
Well, I know we're running long, but I just have
Yes.
one quick question.
Okay.
Can physical therapy come before surgery?
Oh yeah, 100%. I know the way you said that, but it's so true. And here's why I say that, because sometimes there's this long-standing belief, and I say this, I've been doing it for 20 years, and I am old. The only the one that top of mind right now is ACLs. Like, we used to believe that if you ruptured your ACL, especially if you were an athlete, you had to get it surgically repaired. There is new research that has come out in recent years, and I won't go into it because I nerd out on it. But
I say y'all, she's a nerd. So.
I love it. I mean,
We'll be here
so
all
are
night.
you.
We'll be here all night.
You like it too. But there has been research that has come out and shown that a full tear, complete rupture of the ACL can heal on its own. but it takes like 2 years or longer. So we don't always have the time for it. But so when you say is surgery always the answer? No. Our body is amazing at healing itself. How much time do you want to wait for it? And then what are your expectations of it? So that's where I'm going to have that
What else are you willing
conversation.
to do to help it heal?
Yes. And then I'm going to have that conversation about, you know, if this is where you want to get in this time frame, like, let's talk. But surgery, no, it's not all, it doesn't always have to be the answer. And then there are times where I am going to say, yeah, you need surgery.
Well, there's a role for PT in preparing, even if you know surgery
for
is the
surgery.
answer. There's a role for PT in working towards that surgery to make your recovery after.
Yes, because the stronger you are
Going in.
you're going to recover so much better going out. So, yeah. So I would say, yeah, surgery is not always the answer. Injections are not always the answer. A lot of times they don't do anything. Pursue your options. Just do your research. I do highly recommend a second opinion. Look, if you just want to come in and get the eval and hear what I have to say, let's do it. I think that's even worth it because I'm going to
I'm
tell
such
you.
an information gatherer that any decision, I think the more information you have, the better.
Yep.
Medical, physical.
Yeah,
I mean,
for everything. I know. I feel like I could keep talking. I know we got to stop.
I know
We're
we've kept
over.
them long enough, but I think
know.
this was great.
Thank you guys so much for
Thank you all
joining
for
us.
hanging out.
It is always a pleasure. And whether you like it or not, we will be back again next month. So stay tuned, date and time and topic.
TBD, baby.
But we will let you know. Good night.
Good night.